MDwise, we have what is known as a health needs assessment, and H&A, HRS is called different things, but essentially it is a long assessment that the state requires that we capture on every member that asks a number of questions, medical, behavioral health, socioeconomic questions. It gets us a plethora of information on our members so that we can help properly coordinate care. In addition to this, it is part of our state contract to submit this information back to the state, so we have a reporting requirement, a statutory reporting requirement around this process. Our customer service representatives actually do this assessment because it is just a straight question and answer and doesn't require a clinician to actually do. However, having said that, it has so much vital information in it, we wanted to make sure it was readily available. So we chose to bring this into our platform and have our customer service representatives actually do the H&S straight in Jiva. We did this for a number of reasons. Number one, if you need temporary customer service staff, you're pushing out a web-based program, so you don't have to give the organization access to your network. You can just give them access to the web browser. We also really liked it that we could push out the results to both the member and the provider portal, so members could see, kind of where they found their answers, or in many cases they could complete the assessment on their own. With the provider portal, we've pushed it out so that our providers can review the assessments and see what their members are answering. So that just getting the assessment and pushing it out to the proper people so everyone can see what it is. Obviously our case managers can review it as it's inside Jiva when it's being done by our customer service staff. That was kind of priority number one. Priority number two was to be able to use the information that's in that assessment to actually make impact on our members. So we took the assessment, and through back-end tools in Jiva, we were able to develop stratification logic that takes answers to questions and can appropriately stratify members into specific conditions and or risks associated with those conditions. We have actually also phase 3, which is to build the system so that we can take answers from these assessments, and instead of just stratifying them and alerting the case managers, actually creating a CM episode so that they can start their care and automate that process a little bit, so it takes even more work off of the staff trying to gain this. And of course, given that the assessment was done in Jiva, we were able to pull together a report to give to the state showing that we are, yes, in fact, completing these. We were able to give detail. Here are the questions, here are the answers that we received from these members. So it's really been very helpful for our organization to collect this information, use this information, and then pass the information back.